Hi everyone, this is Chree, and today I have the pleasure of introducing you to Legacy's new CEO, Bobby Hilliard. Bobby, tell us a little bit about yourself.
Hi, Chree. Thank you for introducing me. I really appreciate it. I'm a native Texan, born and raised in San Antonio. Went to the University of Texas at Austin for undergrad, majored in social work. Then I went to medical school back in San Antonio and came here to Houston for residency. I'm an OBGYN by training. Practiced at St. Joseph's Park Plaza, Herman, loved it. Eventually went back to business school and I sort of crossed over into the corporate America for the past 15 years or so before joining Legacy.
You were on the board of Legacy prior to becoming the CEO. Tell us a little bit about that experience. What interested you in Legacy and being a board member?
When I moved to Houston in 1997, I came as a resident and I heard of this thing called the Montrose Clinic. And as a person who was still sort of realizing who I was as a gay man, I was cautiously wanted to explore what that was like to work there. So I went there trying to volunteer. As I grew in my career, I had the privilege of meeting Katie Caldwell and yourself, and one thing led to another, and I got to join the board.
You knew us then, and then you saw the growth that we began. So you've seen that transformation.
I am a proud donor to Legacy.
You are?
And my son's bricks are there proudly displayed at Legacy Montrose, so I'm very proud of that. One of the things to me about Legacy is that to see where we were, and now the number of people we're able to touch, the lives we can touch, to make sure that everyone knows that Legacy is a home for them. We don't care. We don't care where you've been. We don't care what you look like. We don't care about any of that stuff. We're a home for you. And I hope that people understand and that our donors understand that, we are a home for everyone.
Well, right. And I'm glad you mentioned that because a lot of the work that we're talking about, we couldn't do without philanthropic support. We just had the Frank Billingsley 11th Annual Golf Tournament. And that golf tournament raised a little over $170,000. We had 35 teams. And it's for our school-based healthcare and our school-based health clinics.
So we have 33 school-based clinics today and counting. I've had the privilege of seeing many of them, and they are just an amazing place, right? They offer behavioral services, primary care services. A behavioral specialist was telling me that she will go get a kid out of class, take him or her to counsel them and take them back to class. When class is out, the kid will scream, "Hi, Mrs. Smith, that's my therapist." There's no shame to behavioral health anymore. It's great.
Our literacy programs called Little Readers Program. When our children come in for a well child visit, they receive a book, at the age-appropriate book. That program is totally funded with philanthropic dollars.
Kids who are read to, who hear a spoken language at an earlier age, have better cognitive skills, their vocabulary grows, and they do better in school. So it's not even a question that our literacy program changes the lives of kids forever.
We're just so blessed at Legacy to have so many supporters and so many people that really care about our work that we do because they care about the communities that we serve. And I can't wait to take you to meet donors, special friends of Legacy. So do you have a message for them, Bobby?
Yes, I do, Chree. I am honored to be the CEO of Legacy. I am honored to follow an amazing woman as Katie Caldwell and what she built over 25 years. I'm humbled by it, and I hope that I can earn the trust of the donors and help them understand that I will continue her vision, to continue a new vision, and make sure Legacy is a home for all.
Thanks, Bobby. Thanks for spending this time, and can't wait to take you out to the community and introduce Bobby to each of you. And I just want to, as always, thank you for your support. You're making a difference in the lives of so many. Thank you.